Trump, his more controversial selections are to head the agencies that he cares most about, that he thinks represents the deep state. DOJ, the intelligence services, you could argue the health because of how the pandemic was handled last time around, even the Department of Defense. But we should note there's a bunch of voices coming out against Kennedy's nomination. One notable one, maybe surprising one, the editorial board of the New York Post, which is out with a piece this morning with this headline: putting RFK Jr. in charge of health breaks the first rule of medicine. The board writes in part this: the overriding rule of medicine is, first, do no harm. We're certain installing Robert F. Kennedy Jr. to head Health and Human Services breaks this rule. We sat down with RFK Jr. back in May 2023. When it came to the topic of health, his views were a head-scratching spaghetti of what we can only call warped conspiracy theories, and not just on vaccines. Neocons are responsible for America's policy ills. Pesticides, cell phones, ultrasound could be driving an upswing in Tourette's syndrome and peanut allergies. He told us with full conviction that all America's chronic health problems began in 1 year in the 1980s when a dozen bad things happened. In fact, we came out thinking he's nuts on a lot of fronts. A radical, prolonged, and confused transition ordered by a guy like RFK Jr., who will use his high office to spout his controversial beliefs, leaves a lot of room for things to go wrong and for people to wind up harmed or even dead. Extraordinarily strong words from the New York Post. A Murdoch-owned paper usually cheerleads Trump's, and a paper we know Donald Trump cares very much about. Joining us now to talk about this, Dr. Kavita Patel. She is an MSNBC medical contributor and a former Obama White House health policy director. Dr. Patel, thank you so much for joining us this morning. Let's just start here with what we know of Robert F. Kennedy's health beliefs and the policy changes he wants to implement. Just what sort of impact would that have on Americans, particularly our children?
Yeah, Jonathan, it's a pretty seismic shift in health policy, period. Public health policy, certainly, because this appointment could lead to just an elevation of all of these prominent vaccine skeptics, misinformation. To your point about children, all we have to do is look at the state of Florida, where the Surgeon General there had been incredibly relaxed about vaccine, not even vaccine mandates, Jonathan. He was incredibly lax about active measles cases, and parents should, quote, decide if you can send your children to school with active measles. So I don't think it's trivial to say that this is undermining the future health of not just one generation, several generations, because think about how long it's taken to end literally polio, measles. We have vaccines that can truly eradicate these diseases. And now we'll see not only, again, an elevation of nothing related to science, not evidence-based approaches, but a dismantling of that critical public health infrastructure. And coming out of COVID, thinking about all the kind of threats that we have to public health in general, I can't think of a time when we needed trust in health institutions, and there's just not going to be any of that with a secretarial appointment at this level.
Dr. Patel, let me just start. This is Sam Stein, first of all. Let me just start by saying that New York Post op-ed that was just read is the equivalent of being surprised that the leopard ate your face. We all knew this was going to happen if Trump was going to be elected. He had said explicitly that Bobby Kennedy was going to get a high-ranking appointment. So for the Post to be shocked by this, that he would turn to someone who said he's had a brainworm. Bobby Kennedy said he had a brainworm, who bragged about taking roadkill bear and placing it in Central Park, who carved off a whale's head. These are some of the more lunatic things he's done. It just doesn't really pass muster. I will say one element that kind of gets overlooked here is that HHS does have broad oversight over a huge swath of government, among them NIH, which is the leading provider of grants for scientific research in the world, okay? Robert F. Kennedy Jr. is on record saying he would stop investment in infectious disease research for 8 years. 8 years, just no infectious disease research for the United States to pay for. Can you speak a little bit to how we would have an absolute brain drain in this country if that were to happen? Scientists, researchers, basically looking for grant money would leave America, go to Canada, go to Korea, go to anywhere else that would pay for the research, and we would be put on the back burner in terms of scientific discovery in this country.
Yeah, and Sam, it gets even worse than that. He also mentioned, this is when he was running for president, he mentioned not just, research around antibiotics or microbial diseases. He kind of made a comment about drug development in general. So think about the progress we've made against diseases. When I started medical school, and it was a bit of a time ago, but it wasn't that long ago, someone with advanced stage lung cancer, it was essentially a death sentence. Now we have incredible monoclonal antibodies, incredible treatments. Now we have genetic therapies. We have sickle cell disease, cystic fibrosis, retinoblastoma. The list goes on of things that we can do. That was American research and drug discovery and innovation that we have made widely available in the globe. We can talk about drug prices as a separate topic. There's no question innovation is incredible. Taking that innovation and basically saying that we're going to export it, punt it, and not even fund it is not only dangerous, but again, it's just putting forward this misinformation. By the way, Sam, I was one of those people that discredited the idea of him getting a cabinet position because I thought managing 11 agencies like Medicare, Medicaid, NIH, FDA, that's hard work. And it didn't strike me that RFK Jr. wanted to do hard work. So put me in that category of shocked and surprised that he got that pick. Because it takes, I've worked in and around those agencies. It's hard work, and it is not something that is for the lighthearted, because you're also negotiating with Congress on how to actually defend and get more money. Before I worked in the White House, I worked for Ted Kennedy. Unfortunately, he is turning in his grave thinking about dismantling the institutions he fought for funding, like the NIH. You can also zero out these budgets, something that you could see a secretary like Kennedy actually recommending to the president to submit in his annual recommendations for a budget. That alone can set back, again, it's not trivial to say generation. I think that what I'm looking for next is who are the appointments to run these agencies under an RFK Jr. That's going to be very interesting to see who has to kiss the ring and basically say that they agree with these policies, and then go run the FDA. Could you imagine?
Really important and terrifying words there from Dr. Kavita Patel. Dr. Patel, thank you so much. So, Susan Page, Robert F. Kennedy's confirmation, not a sure thing. We know that Senators Murkowski and Collins in particular, they're in the Health Committee. They've expressed skepticism of him in the past. But there are just so many of these nominations. It's at least we have to take it seriously that he might indeed run these agencies, whether it's maybe even through a recess appointment. Let's just talk about what this truly would mean. I mean, it is to Sam's point of a moment ago. There's a lot of Democrats yesterday I heard from, who were, angrily talking about those undecided voters who might have broke for Trump at the very end because they were concerned about inflation. It's like, well, this is what you get. Not to say that your concerns about inflation weren't valid. Undoubtedly they were. But by signing up for Donald Trump, you get this. Not only do you potentially get Matt Gaetz as Attorney General, but and you get Tulsi Gabbard, heading the national intelligence agencies, but now you have Robert F. Kennedy Jr. threatening to take away medical research, vaccinations, and even fluoride.
Here's one thing. None of this should be a surprise to any of us. The surprise is only those who didn't think Donald Trump would do what he said he was going to do. He said he was going to give Robert F. Kennedy Jr. a key role in health care. And the thing, Jonathan, that strikes me, we are just at the end of his first full week as president-elect, and he is moving so much more quickly and with so much more intent than he did 8 years ago when he won the presidency in 2016. Think about where we are now compared with where we were then. He's moved rapidly on making some of these key appointments. He's made some that are pretty broadly acceptable and some that have just raised the hackles around the country and certainly here in Washington, even among some Republicans. But it is a demonstration of how different I think this Trump term is going to be compared to the last one, where he surrounds himself with people he knows he agrees with him, who will not be challenging him, and with a much stronger sense of how things work in Washington and how to get done the things that he wants to get done.
We'll have much more on these selections throughout the morning. Next up here on Morning Joe, we will indeed talk about more of Trump's other nominations, plus what his transition team is saying about potential pardons for the hundreds of people who have been imprisoned for their role in the January 6th Capitol attack.